Hi everyone, welcome to Top RN Academy. I'm Anu, I'm one of the tutors of Top RN. I would like to present to you another NCLEX session. Today I'm going to discuss with you about a drug called digoxin, which is one of the hot topics for the NCLEX examination. Whenever we get a question about a drug, as a nurse, you should think what are the other common names of this drug? What is this drug used for? As a nurse, what are your responsibilities to a patient who is taking this drug? What are the side effects of this drug? And what will you educate to a patient who is taking this drug? So, today I'm going to help you find out answers to all these questions. The generic name of this drug is digoxin itself. The trade name is lanoxin. The medical professionals usually call it DIG. Now let's see what is the action of this drug. Digoxin is a cardiac drug. That means it is given for patients with heart conditions. Our heart pumps blood and oxygen throughout the body. Digoxin is a cardiac glycoside. That means it helps the heart to pump more effectively and efficiently. Let's see in a bit more deep how digoxin helps the heart to do this. Digoxin causes a positive inotropic effect to the heart. That means it helps the heart to squeeze or contract stronger. That means digoxin increases the contraction of the heart, thereby increasing the volume of the blood circulated into the body. So, the blood circulation is improved. Another effect of digoxin is it has a negative chronotropic effect. That means it helps the heart to beat slower, giving enough time for the ventricles to fill up with blood before pumping out. These actions of digoxin is a must to remember in NCLEX point of view. So overall, digoxin helps in decreasing the heart rate, decreasing the blood pressure, improve the cardiac function, and improve the blood flow. Now we know how the drug works. Let's see what are the indications of this drug. Digoxin is given for patients with heart failure, cardiogenic shock, and cardiac dysrhythmias like atrial fibrillation and atrial flutter. In all these conditions, there is problem with the heart to pump effectively. So in case of heart failure and cardiogenic shock, there is failure of the muscle fibers so that the heart is not able to contract effectively. So in case of atrial fibrillation and atrial flutter, the electrical impulses are discharged too fast so that it will affect how the blood is pumped out from the heart. So we know the action of digoxin is to help the heart to contract harder and to slow down the heart rate. So, digoxin is given in these patients. Now, let's see the therapeutic range of digoxin, which is very important to be remembered. Dig has a very narrow therapeutic range, that is 0.5 to 2 nanogram per milliliter of blood. If digoxin in the blood is more than 2 nanogram in 1 milliliter, it is toxic and it will cause toxic effects to the body. Now let's see what are the side effects of digoxin or what are the signs of digoxin toxicity. Digoxin toxicity is a fatal condition and it is one of the main responsibilities for a nurse to look for in your patients who is taking digoxin. Let's see what are the signs of digoxin toxicity. We already have discussed the therapeutic range of digoxin, which is 0.5 to 2 nanogram per milliliter. Anything above this range, which is anything above 2, is in danger. The earliest signs and symptoms of digoxin toxicity are GI related. They are nausea, vomiting, diarrhea, anorexia, and later on in the late stages, the patient will have blurred vision and the patient will see an yellow greenish vision, or it is called halos. So these are the main signs and symptoms of digoxin toxicity which a nurse has to monitor for the patient. So, if your patient is experiencing signs of digoxin toxicity, what do you do? If your patient is experiencing any symptoms like nausea, vomiting, halos, or blurred vision, as a nurse, your responsibility is to hold the further doses. Do not allow the patient to take the digoxin for that day and notify the physician immediately and arrange for a blood test to check the digoxin level in the blood. And if the digoxin level is too high, administer the antidote for digoxin, which is digibend or digifab. Now we should think, even though we given only the prescribed dose of digoxin, why is the patient getting digoxin toxicity? What are the main causes? The main cause for digitoxin toxicity is electrolyte imbalance. This is very, very important in NCLEX point of view. Hypokalemia is the major cause for digitoxin toxicity, low potassium level in the blood. Also, hypercalcemia, which is high calcium level, and hypomagnesemia, low magnesium level in the blood due to various reasons, maybe due to other condition the patient is having. It is very important for a patient taking digoxin to monitor the electrolyte level in the blood, especially potassium. Now, who is at most risk for developing digoxin toxicity? Yes, the elderly patients, because most of them may be having a renal or liver function issue. As we know, the drugs are being metabolized in the liver and it should be excreted through the kidneys. If they have a problem in the liver and kidneys, the digoxin will be accumulated in the body and cause toxicity. Now let's move on to the last and most important part, nurses' responsibilities. One of the action of digoxin is reduce the heartbeat. So the patient's apical pulse should be checked for 1 full minute before the administration of digoxin, because digoxin is further going to reduce the heart rate. If the patient heart rate is less than 60 per minute, in case of an adult, if the heart rate is less than 60 per minute, the dose should be held. The dose shouldn't be given. For children, if it is less than 70 beats per minute, do not give that dose. For infants, if the heart rate is less than 90 beats per minute, do not give the dose. What should you do? You should wait for a 5 or 10 minutes, check the heart rate again, then only administer the drug. If the patient's heart rate is still low, inform the physician, hold the dose, do not give the dose. Also, it's very important to educate the patient regarding the signs and symptoms of toxicity, the importance to check the blood level of the drug, the electrolytes, check the liver and renal functions are okay or not, and to advise to consume foods rich in potassium like potatoes, or pork, oranges, tomatoes, avocados, spinach, bananas, etc. And also teach them how to check the heart rate before taking the medication every day, and to report if there is any low heart rate, what they should do. Thank you and hope you all understood about digoxin. Hope you all enjoyed the video today. Thank you for joining me today and please subscribe for more NCLEX videos.